Today I want to talk about a common condition that affects a lot of people. It definitely has an involvement with nutrition, and it's also genetically has a genetic predisposition. I'm talking about kidney stones. Kidney stones are, I've heard people compare passing a kidney stone. The pain involved is comparable to giving birth to a child. Quite a few people who have passed kidney stones have told me that. I have no doubt that it's true. As I said, there is definitely a strong genetic connection between acquiring kidney stones. For some reason, probably because the way your body handles minerals like calcium and other substances like oxalate, some people have a tendency to form kidney stones. The most common type of kidney stone is formed from calcium oxalate. Calcium, of course, is a macro mineral. It's essential in human nutrition. For years, doctors would tell people not to, if you have a tendency to kidney stones, to be careful about calcium. Don't consume too much calcium because it can cause kidney stones. Now they know that's not true. The actual main factor in whether kidney stones are formed from calcium has to do with the other component of kidney stones, which is oxalate. What is oxalate? Oxalate, also called oxalic acid, is found naturally in a lot of plant foods, vegetables, and it's basically it's considered and some people call it a anti-nutrient, because oxalate can have a tendency to lock onto certain minerals, including calcium, and cause them to be excreted out of the body. Now, does this mean that you shouldn't eat vegetables because they're high in oxalate? No. The amount of oxalate in vegetables, you'd have to eat a huge amount of vegetables to consume enough oxalate to increase the risk for kidney stones. And furthermore, when you cook vegetables, most of the oxalate is degraded, so there's nothing to worry about. One of the main stimuli to causing the precipitation of calcium oxalate. Now, calcium oxalate, what happens is they tend to combine. They more or less form a stone. The calcium combines with the oxalate, it precipitates, forms a stone. Now, one of the ways that you could minimize that or help to prevent that, and this is very important, is always stay well hydrated. Dehydration greatly increases the risk of kidney stones. This applies to bodybuilders who often greatly reduce their water intake. If you have any tendency to acquire kidney stones and you're not consuming enough fluids, water, you could easily develop kidney stones. Sometimes you might have to follow what they call a low oxalate diet, which limits the amount of oxalate you take in to 50 to 100 milligrams a day. You could find the oxalate content in food by going online and doing a search for the oxalate content of foods. But another risk factor, probably even greater than the oxalate problem, is having too little of another substance called citrate. Citrate, as the name implies, is found a lot in fruit and fruit juices. Citrate tends to prevent the precipitation of minerals and formation of stones. In other words, citrate actually, if you have enough citrate, it will actually prevent the formation of stones. Now, what would cause too little citrate? Citrate, as I said, you get it if you from fruits and fruit juice. If you don't eat a lot of fruits, you could be getting too little citrate. But usually it's due to gastrointestinal problems such as chronic diarrhea and intestinal inflammation conditions like colitis and irritable bowel syndrome. Certain class of drugs can cause excess excretion of citrate. These would be called ACE inhibitor drugs, which are often used to treat high blood pressure or hypertension, and microalbuminuria, which is excess protein in the urine. Examples of ACE inhibitor drugs include Lotensin, Captotin, and lisinopril. Low alkali diets, and as I said, diets that are low in alkaline foods like fresh leafy greens, vegetables, and citrus fruits also tend to ingest far less citrate and you increase your increase your risk of forming kidney stones. Now, are there certain supplements that can help reduce the risk of kidney stones? Well, one of them is potassium. Now, strangely enough, potassium is called an alkaline mineral, but it's not the actual potassium that does it. It's what potassium is combined with. Potassium in supplement form is always combined with something else. For example, a common potassium supplement is potassium citrate, and there's really good evidence that potassium citrate can inhibit kidney stone in a large percent of people who have recurrent kidney stones. One study found that patients who took 6,480 milligrams of potassium citrate daily, divided into 3 equal doses, one dose taken after each meal, had no stone recurrence after 1 year, compared to a 28.5% stone recurrence in patients who did not take potassium citrate. Other citrate compounds that could help prevent kidney stones include magnesium citrate, which is an easily absorbed form of magnesium. However, you got to be careful with magnesium citrate, because take a little bit too much of it, you get raging diarrhea. Sodium citrate also can help prevent kidney stones. I take I've been using potassium citrate powder for quite some time. I don't really take it to prevent kidney stones. That's incidental. I've never had kidney stones. No one in my family, to my knowledge, has had kidney stones. I take the potassium just as a supplemental form of potassium. It's very convenient. Anytime I eat a food or anything that contains excess amounts of sodium, I balance it out by taking a little bit of potassium citrate powder. Because if you take, for example, if I eat let's say a food I'm eating has 1,000 milligrams of sodium, if I take 500 milligrams of potassium, the negative health effects of the sodium are neutralized, including possible effects on blood pressure and water retention. That's why I take potassium citrate. What else can I say? Potassium phosphate is another supplement that can help people prevent kidney stones, because the phosphate decreases excessive calcium in the urine. Excessive calcium in the urine is a risk factor for the formation of kidney stones, especially if you're also ingesting a lot of oxalates. However, calcium itself, how's this for circuitous reasoning? Excess calcium in the urine increases the risk of kidney stones, yet calcium itself promotes the excretion of oxalate, which is the other component of the most common form of kidney stones. Potassium bicarbonate is another form of potassium that can help dissolve kidney stones. Different types of juices that contain citrate, lemon juice, orange juice, these even Crystal Light, these things contain citrate, and they will help, again, keep the oxalate from precipitating with calcium to form stones. There's a supplement found in a lot of fat burner supplements called hydroxycitric acid. It's a component of the Garcinia cambogia plant. It's very similar in structure to citrate, and they think that this HCA can actually also help to prevent kidney stones. There's not a lot of information about that. A lot of people who have a tendency to kidney stones are told not to drink tea because tea contains oxalate. Well, the type of tea that contains more oxalate is black tea, but green tea actually helps to prevent oxalate. It helps to it reduces a component in green tea called EGCG, which is the major antioxidant in green tea. Actually, studies have shown it reduces kidney stone formation. Some studies show a decreased risk of kidney stone formation of 8 to 14% in men and women without a history of kidney stones who drank 2 to 3 cups of tea. Coffee. Now, coffee contains oxalate, which can contribute to kidney stone formation, but the studies show that regular intake of coffee lowers the risk of kidney stones. A lot of this has to do with the fact that caffeine has a bit of a diuretic effect. One study showed one serving of caffeinated coffee produced a 26% lower risk of kidney stones in those who drank the coffee compared to those who did not consume the coffee. And what else can I say? There's a herb called chanca piedra. It's also called stone breaker, because in traditional medicine it's been used to break up kidney stones. Personally, I've never heard of this. I don't know. I haven't checked. I don't know whether they sell it online. I'm sure they do, because so many people seem to suffer from kidney stones. There was a study among 56 people with an average of 44. They had small kidney stones, and they drank 250 milliliters, or about 8 ounces of tea, infused with 4.5 grams of chanca piedra twice a day for 12 weeks, and reduced the total number of stones for each person from 3.2 at baseline to 2.0 after treatment, with about 68% of participants showing a decrease in the number of kidney stones. So that's something else to consider. Now, what about the supplements that could increase the risk of kidney stones? Well, calcium. They say that taking isolated calcium supplements, our study of women showed that when they took calcium from supplements, they showed an increased risk of kidney stones. However, observational studies found that higher dietary intake of calcium, averaging 800 to 940 milligrams of calcium per day from dairy sources, including milk, yogurt, and cheese, was associated with a 17 to 24% lower risk of kidney stones in men and women compared to a lower intake of calcium. So, why calcium would it cause? Why supplemental calcium would cause kidney stones and calcium from food would not is kind of mysterious. However, it could be that the supplemental calcium, because it's kind of in a free state, could react faster with oxalate that might be, you might be taking in from vegetables. So that's probably why supplemental calcium has an increased risk of forming stones, whereas calcium from food does not. There is a form of calcium called calcium citrate. Again, because of the citrate in the calcium, that form of calcium will not form stones. And also, calcium citrate is the most absorbable form of calcium, supplemental calcium. It's the only form of supplemental calcium that you can take without food. Other sources of supplemental calcium you have to take with food because you need a release of acid in the stomach, which is stimulated by food to absorb calcium supplements. But with the calcium citrate, because of the citrate already attached to it, you can take it with a glass of water. Now, strangely enough, the supplement choline, which is a popular supplement, bodybuilders use it. They think it helps to burn fat, which it does not. But choline is important for the formation of acetylcholine, a very important brain neurotransmitter that's linked to intelligence and memory. It's the first neurotransmitter to go when you have brain diseases like Alzheimer's. There's a supplemental form of choline called choline bitartrate, which happens to be the most common supplemental form. Taking a large amount of that can lead to a rare type of kidney stone made of crystals of calcium tartrate tetrahydrate. It's only been reported in 3 men, but these guys happen to be taking large amounts of choline bitartrate. Collagen supplements. Collagen, when you ingest it orally, is converted in the body into glycoxylate, which is a precursor for oxalate formation. At high levels, it could possibly increase the risk of kidney stones. One study showed that those who consume large amounts of collagen increased the oxalate levels in the urine, but consuming small amounts did not. However, I'm not sure whether this applies to regular collagen. I don't think it would apply to hydrolyzed collagen, which is the more common supplemental form. So it's hard to say. Turmeric and curcumin contain pretty good amounts of oxalate. Again, that increases the risk of kidney stones, especially in those who are genetically predisposed to forming kidney stones. So if you have a genetic tendency to form kidney stones, be careful of turmeric and curcumin. Vitamin C increases oxalate absorption from foods. So theoretically, excess amounts of vitamin C can produce an increased risk of kidney stones among people who have a history of kidney stones. In other words, if you have a pre-existing history of kidney stones, you might have to be careful with taking high doses of vitamin C. But for all others, it's not a problem. Almonds can increase the risk of kidney stone because they're high in oxalate. Almonds are loaded with oxalate, so be careful of almonds. Same with almond milk. Chia seeds can also contain a large amount of oxalates. Cocoa and dark chocolate are high in oxalates. Cocoa powders tend to contain higher concentration of oxalates than chocolate bars. Cranberry juice contains moderate amounts of oxalate. The plant-based meats can increase the risk of can increase the risk of kidney stones compared to eating the actual meat like beef, pork, or chicken. I'm not sure. I guess the plant-based meat substitutes, since they're plant-based, probably have greater amounts of oxalate. Things that are said to help prevent kidney stones that really don't help include apple cider vinegar. Apple cider vinegar is thought to help prevent the formation of kidney stones because of its acetic acid content. But there's no real clinical study showing that it does that. Apple cider vinegar is very good for other things. I'm not going to get into in this video. Coconut water has been thought, some websites and videos say that coconut water can help prevent kidney formation. Some websites say it can even dissolve kidney stones. There's absolutely no proof to that at all. In fact, a study found that compared to tap water, coconut water increased citrate in the urine by an average of 29%. So that's about. I think that really covers the waterfront as far as kidney stones and supplements that might stimulate it. I should also mention, this is really important for those of you who have a genetic tendency to form kidney stones or have had kidney stones in the past. If you take vitamin B6, also known as pyridoxine, it's one of the B complex vitamins, and you take it with a magnesium, take a more absorbable form of magnesium, such as magnesium glycinate. If you take B6 and magnesium glycinate, it will actually prevent the oxalate from precipitating with calcium to form stones. In other words, as long as you keep calcium and oxalate in a more or less liquid form where they don't harden up, they're not going to get stone formation. And that's what magnesium and B6 can do. So that's just a little tip. If you have any genetic tendency to form stones, again, make sure that you're getting enough magnesium. Again, magnesium glycinate is one of the better supplemental forms. Magnesium citrate would be good too. Magnesium citrate might even be better for this purpose because of the citrate content. But remember, magnesium citrate is used as a to get you ready for colonoscopy. It clears you out. In other words, it makes you go really fast. So you got to be careful of magnesium citrate in large amounts. I think that's about it for this thing about kidney stones. I'm going to probably have an article in my Applied Metabolics. There's a lot of other aspects of kidney stones that are too extensive to get into this video, but it will be covered in my Applied Metabolics. My Applied Metabolics, it comes out every month. It's 30 to 45 pages, covers a gamut of topics more extensive than any other digital publication, including nutrition, exercise science, anti-aging research, ergogenic aids, effective fat loss techniques, hormonal therapy, supplement science, women's health and fitness. All of these are covered in Applied Metabolics, which also includes my over 60 years of experience and constant study, which is incomparable to my knowledge. You can get 30 PhDs and not come close to the experience and breadth of knowledge that I've accumulated. And I'm not trying to say I'm a genius or put a halo. It's just a fact. I've been doing this for over 6 decades. So anyway, it's www.appliedmetabolics.com. When you subscribe, send me an email. I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new data or studies on nutrition, exercise science, and general health. I have an email portal on my Applied Metabolics webpage exclusively for subscribers, where they can send me short questions, anything they might have read in Applied Metabolics, or anything else that comes to mind about nutrition or exercise. And as an appreciation of their subscription, I'll answer their questions. I will not answer unsolicited questions. However, you are welcome to leave comments under these videos, especially if you have ideas for future video topics. If I think that it'll interest a large number of people, I will try and do a video on it. You can be assured, by the way, my videos are evidence and fact-based. Unlike 98% of most YouTube videos, which are, there's no other word to describe it, bullshit. These people just take stuff out of the air and they try and present it as facts. And they obscure it by putting fancy graphics and little cartoons and that kind of crap. They're nice looking videos, but very poor content. My videos are factual. I just give you the facts, like an old TV show called Dragnet used to say, just the facts. Just the facts. And that's the way Applied Metabolics is too. There's no ads, there's no bullshit, just the facts. Subscribe today, www.appliedmetabolics.com. Also, if you think these videos that I post every week on Tuesday, I post a new video every week on this channel. If you think that they're useful to you, please, by all means, subscribe. Tell others about it, others who want to know the real honest truth about nutrition and exercise and general health. Tell them to come here. They will get the truth. They will get no lies, unlike these other videos. And as you noticed, I'm not trying to sell anything here other than suggest you subscribe to my newsletter, because I think it would be extremely beneficial to anyone. But I don't sell, I'm not pushing any supplements or anything, or I'm not selling t-shirts or mugs or any of that garbage. I don't trust anyone who does that. And a lot of these other YouTube videos, if you look at the information box, they have a list of supplements and links to where you can get them. And it often says 20% discount if you mention me. Those are shills. Those guys are all paid off by supplement companies, and you can't trust them. They're pushing supplements because they're paid to do so. I'm not associated with any supplement company, so anything you hear from me is going to be the honest truth. So that's about it. What else can I say? If you want to have the best friend you'll ever have, go to your local shelter. There's such beautiful dogs. I mean, there's no reason to get a dog at from a breeder. And I'm not trying to criticize people that go for these purebred dogs like Pomeranians and all these other. I love all dogs. However, you have all these great other dogs in these shelters and they're being killed. It's horrible. A lot of them are purebred. I myself, I've studied a lot about canine physiology and nutrition. I would never get a purebred dog, if for no other reason. 2 words: vet bills. Purebred dogs are like humans that marry their cousins or brothers and sisters. There's a much greater chance of birth defects. That's why it's taboo to marry a close relative, because it produces birth defects very often. And the same with dogs. Unfortunately, purebred dogs very often have genetic defects that's going to show up in middle age or as they get older. It's going to cost a fortune in vet bills to treat these dogs. And they're great dogs. I love all, like I say, I love all breeds. But I'm just not going to, I don't want to be saddled with these inevitable huge vet bills that are going to happen with purebred dogs. And to me, unless you're going to be participating in dog shows or something like that, I don't see any reason to get a purebred dog. They have all kinds of dogs in dog shelters: little dogs, big dogs, old dogs. They have blind dogs. They're all great, and they'll be your best friend. Let me tell you, there's something about a rescue dog I've noticed. I've had all my dogs have been rescue dogs, and there's one thing about a rescue dog I've noticed. I don't know how, but they know that you've rescued them. And they show much more appreciation, loyalty, and love than you'd ever believe possible. So again, Go rescue a dog and do yourself a favor. Take care. Thank you for listening.